In our office, we specialize in the treatment of neck pain, back pain, and sports injuries. But one thing people don't realize we treat is vertigo. And if you've ever had vertigo or vertigo-like symptoms, you know how awful of an experience it can be. So you will do just about anything to try to find some relief. Now, there are several different things that can lead to vertigo or vertigo-like symptoms, but we mainly treat two types of vertigo in this office. We're going to go over one in this video, and we're going to go over the other one in a separate video, so be sure to watch that. In this video, we're going to be talking about by far the most common type of vertigo out there and the most common type of vertigo that we see, and that is BPPV. So that stands for benign, paroxysmal, positional vertigo. So we're gonna break that down a little bit. Benign means it's not serious. Paroxysmal means that it comes and goes. Positional means that it's dictated by change of position. And then vertigo obviously means it is associated with dizziness type symptoms. So what is going on here? What causes BPPV? So we have these little things in our inner ear called our semicircular canals. You have three of them and they go in different directions, and basically they are responsible for orienting yourself in space. Now, if something happens with those semicircular canals and they become disoriented, that's gonna throw your perception off, okay? So instead of when you turn and you're able to look one way, then look another way, when you turn, you now lose all sense of where you are, and you get that sense of, okay, the room is spinning and I'm dizzy. So it's basically a dysfunction of those sensory receptors within your inner ear. As the name suggests, this type of vertigo is triggered by change of position. So you may feel it while you're turning over in bed, while you're turning to the side or laying down, and you'll get the dizzies, but once you're settled, typically the dizziness settles down as well. So that's a really good indicator that if you have vertigo, you're dealing with BPPV. So when someone comes to us with vertigo or vertigo-like symptoms, we're gonna take them through a couple tests. The test will, first of all, determine, is this a type of vertigo that we can treat? And then if it is, what type of vertigo are we dealing with? Now, fortunately for BPPV, we have a very reliable test. It's a test where we take you through some certain movements to help determine, okay, is this the correct diagnosis? Once we have arrived at that diagnosis, we can then move on to treatment. And treatment involves taking you through some specific movements to help reorient those semicircular canals within your ear. We're then going to give you some homework, some movements to be doing at home on your own, and we're typically going to see you back for a follow-up treatment to take you back through those movements that we originally did on day one. The good news is that most people respond really well to this type of care, and it does not involve any kind of prescription medication or serious interventions. So if you're dealing with what sounds like BPPV or really any type of vertigo or dizziness that you just can't figure out, we would be happy to help. Please visit us online at TruMotionTherapy.com to book an appointment or to learn more.